Welcome to the NorthLakes podcast. I'm today's host, Jeremy Oswald. On this episode, we talk about Lyme disease with Tom Nigbor. Here we go. Tom Nigbor, tell me who you are and what you do here.
I'm a PA with NorthLakes Clinic. I do a family practice in Hayward, Wisconsin. I've been here for an eternity, actually 30 years, coming up this October.
What does PA stand for?
Oh, that's a great question. It just changed. It used to be Physician Assistant, and as we developed and aged as a group, we outgrew the moniker of assistant. And so they spend millions of dollars and the whole organization research coming up with a new name that would fit what we do as more independent providers. And so they changed it to associate. So it's Physician Associate now.
Got it.
So they could keep the PA.
In the 90s, I was a PA, but I was a production assistant.
Okay, right.
So that was a whole two totally different things.
It's another PA.
Yes, exactly. Wanted to talk to you today about Lyme. Well, is it Lyme disease? Lyme's disease? What do we call it? Lyme.
Yeah, it's not Lyme's disease, and it's Lyme because it was first researched in Lyme, Connecticut. And it's I believe a city in Connecticut that had a really heavy dose of the Lyme disease way back in probably like early 80s. And they first started finding this disease. So it comes out of that area.
So it's not a person?
Nope.
That's what I kind of always assumed.
Yep, it's a place.
And it's not plural or possessive.
Correct. Well, maybe if you live in Lymes, Connecticut. No, still would be Lyme.
Yeah. So what is it? I mean, to start from the very basics, like what is this? What is Lyme disease?
Well, of course, anybody living up here has heard of it plenty because we're a large endemic area. It's a bacterial infection, and it's transmitted by the deer tick, or they're also called the black-legged tick. And those are the ticks with the little orange butts, but in their immature, they're the little poppy seeds, and you can't really, tell the difference. Anyway, the tick carries it. They usually will pick it up. I believe the wood mouse or field mouse is one of the vectors, and through their stages, they'll feed on the mouse. They pick it up from the mouse, then they mutate. They come and they have a very complex life, these ticks, and they come and they feed on us, and they have the Lyme bacteria. It's in them, and then they transmit it. They found that it typically takes more than 24 to 36 hours for them to actually transmit the infection to you. So if you get the tick off in less than a day, your chances are only like 1 or 2%.
So that's the way you get it. It's from a tick.
Absolutely.
And a specific tick. There's no other real way to get it.
No, just that one tick. Yeah, if you have a wood tick, the larger brown ticks, that's where tick identification really can help out. The larger brown ticks, no problems. They're not going to carry any Lyme disease. And of course, the deer ticks can also carry other diseases with them. You'll hear about I didn't just have Lyme disease, I had blah, blah, blah. They can carry something called babesiosis, which is actually a little parasite infection. And then there's anaplasmosis they can carry at the same time, which you become very sick. And you can actually get both at the same time, the Lyme and anaplasmosis. But thankfully, we use the same antibiotic that treats both. So
it's good to know.
Yeah, it's a whole.
So this happens. So I'm out in the woods or wherever, get a tick on me. I get Lyme disease. What happens to me? What does it do to a human?
Okay. Actually, I have kind of a whole story progress thing on there.
Oh, don't let me.
No.
Go ahead. I don't mean to jump ahead.
No, you're good. So as I was saying, right, only the little deer ticks will carry it. Typically, the tick needs to be attached more than 24 or 48 hours. So if it's small and it's not those inflated gray grapes they turn into, typically your chances are a lot less. When you remove the tick, all the infection is in the belly. So when you pull the tick off, sometimes the head's there, and we'll have people come in and they're concerned they're going to get Lyme disease from that head that they pulled off. And there's no Lyme disease in the head. It's all in the belly that you pulled off. So actually the head is more of a splinter type of situation. It might get infected on its own, but typically in a week or two, it's going to work its way out and fall off. And so then the symptoms that you're asking about of the Lyme disease typically are going to occur 3 to 10 days after the tick bite. And they're not very subtle. It's kind of like being hit by a truck. Flu symptoms, fevers, you just feel run down and tired. Joint pains, and a lot of people are like, oh, I have joint pains. It's like, no, somebody took a bat to your knees and your hips, and it's really significant. So you usually know when Lyme hits you. That Lyme rash that you hear about, or bullseye rash, and the interesting thing is our area rarely has the classic bullseye. And the bullseye rash is red around the outside. I might get this wrong. Red around the outside and clear in the center. But typically, we just see the whole large red rash. And that only occurs maybe 50%. You don't, so the whole Lyme rash thing isn't, always there. It can show up where the tick bit you, but what's really crazy, it can show up anywhere in your body. So it doesn't have to be where the tick bit you.
No kidding. Mm-hmm. Okay. Wow. Yeah. Okay. Huh.
Yeah, we had a young kid who came in and really sick, and he had all the Lyme symptoms, but didn't really make any sense. And we'd found a little tick bite on his hip, and he ended up having the rash up in his hair. Huh. No.
That's okay. Well, I'm already glad we're doing this podcast because there's one myth in my life that's just been shattered. So great.
Yeah. What, the Lyme rash itself?
Yeah. I just always thought it would be right where the bite is.
Typically, but yeah, we've seen it. And kids, interestingly, will get a bunch of them. They can have like a bite on their leg, and they get 3 or 4 of these rashes on their chest or their back. And it's not, a lot of times you get bit by the tick and you have that red ring around it. People get very concerned about that. And that's always usually just bruising. It's the size of a dime. You can have a red reaction around where the tick bit you, but again, they're usually the size of a dime or quarter. And the Lyme rash, which is actually called erythema migrans, if you're into all the technical names, it's big. It's 5-6 inches in diameter. It's a large rash. It doesn't itch. It doesn't hurt. It's just there. And that goes away on its own in a week. It just kind of clears out. And besides the rash, oftentimes, especially in this area, I think more than some of the other areas of the country, we can see something that's called Bell's palsy. And it'll almost mimic a stroke. So sometimes people might think that they're having a stroke. And they may not associate the tick bite, but they will have facial drooping, left or right side of their face. And I believe it's just the face. I don't think it typically affects limbs, like a true stroke will. And we'll often see that even before a rash or some other symptoms early on, and they'll have a left or right-sided facial droop. And we've come to, especially if it's Lyme season, start looking for Lyme disease with that type. We'll see Bell's palsy associated with viral infections too, but it's very interesting that it has been seen often here with Lyme disease.
And oh shoot, I had another question. So how often does it happen where someone comes in and maybe they did not know they had a tick bite? It seems like the tick, like I always feel like I know I'm going to have it, but is it often that you get people that have Lyme that didn't even know they were bitten by a tick?
I'm sure there's a number of that. I haven't experienced it because, frequently people are, looking for the ticks or they're having the symptoms, and around here locally, people are just so versed on the Lyme disease but again, I'm certain ER would have much different stories where they've run into people coming in with the symptoms and not being aware.
Sure. Because, you can't, they're hard to ignore.
Yeah.
It's like,
well, you know what? I'm going to take that back. There have been a number of times, especially in the spring when we get the smaller nymph ticks, the little dark ones, and you may not even see the tick or the tick bite, but boom, you get all the symptoms. So you definitely, can have it without noticing the tick.
It seems like that, I don't know, like it just like tick and Lyme just go hand in hand.
Yeah.
I don't want to no shout outs to the tick, but they get they have a bad rap.
I think they deserve it. I'm not a fan.
I don't know. I think I always wonder, would I rather have a mosquito or a tick? And I don't.
Oh, yeah. Depends. Where's the mosquito bite?
Yeah, right. I don't know.
If you get it in India, yeah, no, okay, I'll skip it.
Never put it that way.
Yeah.
So is it hard to detect? You said that sometimes it's here, sometimes it's there, sometimes there's nothing. Is it hard to detect Lyme disease?
Early on, it really is, because when we test for Lyme disease, we're measuring your body's immune system reaction to the infection. And the testing that we use isn't really able to pick that up until about 3 weeks. They've improved it now. They say 2 weeks, but 2 to 3 weeks. So anything before that, you could have the infection. And if you'd run the test, you're going to be negative. So early on, it's kind of up to, the provider that you see, and, we recognize the symptoms and we typically just treat it. Now, if you treat it early, a lot of people are like, well, then I want to come back at 3 weeks to find out if I really had it or not. It doesn't work that way, because we're measuring your body's immune system reaction. If you treat it early with the antibiotic, your body doesn't mount an immune system because you're killing it. So even if you had it and you check it 3 weeks later, there's a good chance it'll be negative. So it's kind of the art of diagnosing Lyme disease.
So that you kind of, you don't take any chances like, oh, we think it might be this, you'll kind of go right ahead and treat it.
Yeah. If there's enough symptoms to support it, we just treat it. They do have, it's called prophylactic antibiotic treatment, you may have heard, where within, I believe, 24, 48 hours after the tick bite, and it's, again, the deer tick, if they're concerned about that, we can give them 2 doses. The antibiotic we use is called doxycycline, and you can give them 2 doses, and the idea there is it prevents the infection. It's about 50-50. It's not 100%, but it's probably the best thing preventative.
Well, it sounds like nobody I know is like, oh, I had a light case of Lyme.
Yeah.
It was right. It's always it sounds terrible. Mm-hmm. So it seems like it's worth taking the chance of let's just treat this.
Yeah. And you have to be careful, because you don't want to treat every tick bite, but you're right. And if you have enough symptoms and it supports it early on, just treat it.
And if, let's say, okay, I've been bitten by a tick, and I pull it off me, is it helpful to you for me to keep that tick and bring it in with me for an appointment?
Or a picture can be helpful too.
Okay.
You don't have to drag the tick around with you unless you show your friends and family.
Right.
But if you're unable to identify it, that's helpful. So that we can maybe look at the tick. And if it's a wood tick, we're like, okay, you're fine. Just watch for infection at the bite site and that type of deal. But then if it is a deer tick, it can, we can try the prophylactic dosing, maybe offer blood testing at 3 weeks. That's another thing too, is, you can always do the blood test, give it 3 weeks. But if you've got the symptoms that happen in the meantime, well, call me, let me know. We can get you treated beforehand. But some people just want to know, and then you can check at 3 weeks.
But you're not taking the tick down to the lab and analyzing it for Lyme.
In the early 80s, that was the deal. I think you'd send them to Marshfield and they would do some voodoo testing or whatever. But nobody does. At least that I'm aware of, nobody does.
Okay, so that's run its course. So I'm not crazy.
So.
I've heard this before.
Oh, yeah.
Okay.
Yeah, I don't think anybody's, I'll probably be wrong. Somebody's going to say, so-and-so. But yeah, that's not real common.
Okay. And that's neat to hear that you don't get a subtle case of this. It sounds like it's like you either have it, you don't, and you feel it. Like the joint pain is super intense, and you feel it.
You do. Flu symptoms, fevers, joint pains. The rash is 50-50. If you get the rash, that seals it, and all that. Like I said, usually in 3 to 10 days. The other thing too is with the antibiotic, there's a pretty quick turnaround on symptoms. So if you're really suspicious, you do the antibiotic, and in 24 hours, they're feeling a lot better. It's like, oh, okay, well, there you go. Yeah.
That's got to feel good.
Yeah.
That happens.
Yeah.
So when somebody does come in, like you've already kind of named these symptoms, do you have moments where you're like, oh, yeah, that's Lyme?
Oh, yeah.
Yeah, it's easy to tell.
Oh, yeah. Like I said, they got the EM rash. I'm sorry, EM is the erythema migrans. We call it EM for short. They've got the rash. They've got all the symptoms. It's a no-brainer.
And specific time of year, like we're kind of doing this in the spring. I'm guessing this might be a hot time of year, but
spring, fall, yeah. But of course, year round. And that's a hard thing.
They don't seem to die. No. Like they're everywhere.
They are tough. I was just reading up on that the other night, and they can survive winters like below zero, and they like burrow under the litter leaf. And unless it's, I guess what's really hard from them is big swings. So if you go like really cold to really warm through the winter, that for some reason really messes them up and you get good die-offs. But if it's just really cold,
they just hole in.
They're amazing.
Oh my God. Okay. I'm going to get excited now when it's like really warm this day. And I'm like, I can't wait for the snow, like the cold, just to think all the tick dying. And is it, what about places in the country or internationally?
Both.
I mean, is it like, does it happen in the desert or is it just in the woods? I mean, I from what I understand, like kind of Minnesota, we're in a hot spot up here in northern Wisconsin. What about the rest of the country?
So, I don't believe the desert. I mean, there's different tick diseases. Colorado has the Rocky Mountain spotted fever and that their own tick. And I think Texas has a different tick deal. But the Lyme is right. East Coast, Connecticut, Vermont area, Wisconsin, Midwest is a hot spot. Seattle area, and I think Northern California are kind of this country's Lyme hotspots. Europe's got it going. I guess Asia does. Europe, again, the woodsy, a little colder, so you have like, Czechoslovakia, Germany, Eastern Europe area is pretty endemic also. I believe their strain of the bacteria that infects it is a little bit different, but it still falls under the umbrella.
And is it an evolving kind of disease? I mean, is it like changed? Is it like, because I guess here's what I hear, and we don't need to dig into this too much, is that like, that it's become more complex, and that like it affects people in different ways, or that it's getting stronger, or is that just me like listening to too much chatter? I'm not know what. So unlike a virus like our wonderful COVID that can mutate and change and become stronger or weaker, the bacteria don't typically mutate. They can become resistant to different antibiotics, but you don't see a lot of different mutations, so they usually aren't going to get stronger or weaker. The Lyme has been pretty stable. We've always used that antibiotic doxycycline pretty much from day one. And it still is effective. It still is the number one antibiotic that we treat with it. Unless children, you have to use a different antibiotic, and that's amoxicillin, and we've used that forever too. The thing that's changed initially was 3 weeks of the antibiotic. And then they shortened that to, I think it was like 14 days, after like 10 years. And now recently they're saying like 10 days, which is the same thing that we use for that other antibiotic or infection, anaplasmosis I was telling you about. So that's the only change, which is kind of weird because it's going opposite of what you're talking about, which actually is kind of common in medicine. They start hot and heavy and then we pull back and we find, we didn't need that much. We didn't need that much. And because, so here I'm going to just show how silly I am, or like what I don't know the world. It's because it is not a virus, it's a bacteria. There's not a vaccine for it. No. Well, there was. Okay. Maybe I'll re-ask that question. I'll just ask. There are some vaccines. Okay. They have the vet vaccines for Lyme. It's like, I don't know why they don't do it with humans. I'm sure there's some reason. And initially, must have been like early 90s, they came out with a Lyme vaccine. But they had to pull it from the market because the vaccine was causing arthritis. Oh. So it's the Lyme. Okay. And actually, that kind of segues a little bit into, people talk about the Lyme symptoms if it's not being treated. So there's like the chronic Lyme. Typically, we pick it up because people are more aware of it now. But early on and occasionally now, if it's not treated early enough, and that's usually about 3 months, if it's left after that, you can develop some long-term complications. You can still clear it up with antibiotics. It's a longer course. It's usually maybe a month. We'll actually send those people to infectious disease specialists because they know how to eradicate the longer Lyme. But it can cause long-term arthritis. You can develop nerve problems, even cardiac issues if it's not treated in enough time. And like I said, that's usually within 3 months.
which brings me up to my second segue. Early on, I was talking about how we'll recommend maybe if you've been bitten or if you don't have enough symptoms to wait and treat it 3 weeks. And so a lot of people are like, yeah, what kind of, you're asking me to wait 3 weeks. What kind of damage is this going to do to my body? And really the answer is none. Within 3 weeks, we can treat it and you're not going to have any of those long-term complications.
Excellent. And what can people do to prevent it? Other than be careful, to stay away from ticks if you can.
Yeah, good luck around here.
Well, yeah, exactly.
Right. Just the same thing, we kind of always preach, where, unfortunately the DEET spray, make sure that you've got socks. They talk about if you're going to be out that you tuck your pants into the socks. It doesn't give them access. But really the most important thing is each day if you've been out and about is to do a tick check. They need to be on more than 24 hours, and if you get them off, you're good to go. And the removal, the best recommendation is get yourself a little tiny pair of tweezers, and then where the tick is embedded in the skin, you'll have the belly sticking out, but you can kind of see the neck. You just take the tweezers and you go up close to the head, right next to the skin, and you pull it out backwards, and 9 times out of 10, the head and everything will come out. If the head doesn't come out, you can come in. We take them out all the time, or you can leave it and it's going to work its way out.
Who's your typical person that's coming in with Lyme disease? I hate to say that there's a typical one, or isn't there? Is it everybody gets it, or the outdoors people, or who? Everybody. We get more panic from tourists, of course, coming in, and they've had the tick bite, and of course they've heard about Lyme disease, and they may live in Florida or whatever, and a lot of them will want the antibiotic right away, and of course you can't treat. That's really important. I mean, nobody wants Lyme disease, and we can't do that prophylactic 2-day treatment thing I was talking about. But a lot of times people want, the full course every time they have a tick bite. Well, you would be on antibiotics all summer long. If you really think about how many ticks you can, especially if you're outside and you're active, how many ticks you can have. So that's not realistic. But little kids up to 80-year-olds, everybody's affected. Okay. And as far as IDing what this brown-legged or deer tick looks like, I assume because you've been looking, but it when you see it. Mm-hmm. Do you have any suggestions on someone where they can go to look to find a different what they look like?
And it's really, of course, I know Surrey County, they have pamphlets with lots of the pictures on it, which is really helpful. And they hand those out. You can head there. Of course, just Dr. Google has lots of ID stuff, and you just you just Google the deer tick or the brown leg, and they'll show it. They're quite different from the normal wood tick. And so once you kind of see this, you're like, oh yeah, because they have the little orange butts and they're more oval, they're not round. But in their and I'm gonna forget the name, the first stage when they're just the poppy seeds, they all look the same. So you're kind of and that makes it much harder.
And anything special? Are there special populations that should be more careful around it? Are older people, younger people, pregnant people, that should be a little more sensitive about this? Oh, yeah.
I think definitely with it's riskier for older, especially if they get that anaplasmosis I was talking about that can happen at the same time. A lot of times they'll end up very sick and very much in the hospital. Anybody older, and especially if they're on immunosuppressants, they may have rheumatoid arthritis or something like that, or they're taking prednisone, anything that would allow the infection to really take off like a wildfire. There's a lot more risk there. So we want to get those people. And when you're older too, I'm older, so I can say this, our immune system is not just, cranking out like a 20-year-old's.
Right.
And so it's going to hit us a bit harder. Mm-hmm.
And any danger of getting it multiple times? Or is it easier to get after you've had it once or anything like that?
Yeah, these are great questions too. I'm going to address that, but I'm going to pull back a little bit.
Sure, yeah.
So the question is on the testing. for it. What do we do, and are the tests accurate? For a while, there are people coming around saying, kind of really spreading misinformation that the tests aren't accurate, and there's these special labs you need to do to diagnose it, which actually wasn't true, and they've gone out of business. So the tests that we use, it's a two-step process. There's an initial screening test that's fairly sensitive, and it tells you if you have it or not. And then there's a second test that's typically done called a Western blot, and that's looking at the immune system itself and all these. It's actually fairly complex. There's all these levels of antibodies that they look at, and by that test, they can tell, is this a new infection? Right? Or is this an old infection? Because once you've had the infection, your immune system has already been activated to fight it, and it's going to come back positive. So how do you know that this is new or old? So the second test identifies new antibodies or old antibodies, and then we can decide how to treat it.
Oh.
So you can get infected, every year. You can get infected. We've seen people, unfortunately, like twice in 6 months. Although that testing is harder to figure out. But the second test allows us to make that decision.
Mm-hmm. I was just shaking my head like that. The complexity of your world is amazing. I'm so excited that you nailed it down.
They just drill it into us.
I love it. And so is it, if someone does get it once, is it easier easier for them to get again, or is it worse, or
similar?
Can you tell, or?
If you think, because it's a bacterial infection, so it's unfortunately not like a viral infection where you maybe build up more resistance. So if you think more of it like a strep throat, you can keep getting strep throat over and over, and the same with the Lyme disease. You can, you're not any more resistant.
So it's like when I get a cold, it's like, oh, you're getting the cold again. A cold again. I guess I've had one every year for, ever.
Right.
It's not like they've gotten worse over the years.
You should be getting less.
I know, right?
Right.
I'm working on it.
Okay.
Tell me a little bit more about the vaccine.
Okay. I believe, from what I've heard, that they are currently working on a vaccine. It's been a long haul, and unfortunately, this is way above my pay grade. I don't know what the issues have been. Back in the 80s, they had a immunization, and they were putting out, but they had to stop it because the immunization itself was causing quite a bit of arthritis, and we're trying to prevent that with the Lyme disease. So I know that they are researching it, and we'll keep our fingers crossed.
So what motivates that research? That's where I was kind of asking about like how regional it is. It sounds like it's all over the nation.
Right.
So it's not like just a northern Wisconsin problem. So what fuels that research? Is it the pharmaceutical companies that they can provide a benefit, or is the CDC, or like who's kind of driving that ship?
Well, it's always the pharmaceuticals. You want to assume that their head's in a good place and they're trying to prevent potentially bad disease. Of course, they make income off of it. The CDC usually doesn't drive any of that stuff, and it's independent pharmacies. I wish I had more information on like where they are and who's researching it, but it's not like just it affects a lot of people. Oh, yes.
So it's like it's not just like,
it's not like 2,000 a year. It's we could look that number up, but it's a big number.
So it's not like it's like people are working.
Yes, the people.
Yes, right. And so that's good. And then how do you I guess I'm going to dig into a little bit more about your job kind of. So how would you learn more about that? So when there's something new about Lyme disease that comes out, how would you learn about it?
We evolved with it initially when it and I believe it was really early 80s. They kind of got going. I'd have to look that up, but we'll use that number for now. And so, we evolved with it, and we had to because of this being, such an infectious area. So we really had a lot to know about it. We had to know a lot about it. Interestingly, we would have people even getting as far south as Eau Claire early on, and the providers there didn't have a clue. and we're like, oh, that's just Lyme disease. And they're like, or even Madison. That's changed. But, even 10 years ago, there was just kind of a big disconnect, and it being more northern Wisconsin. As far as like new changes that go,
But that's kind of cool. Like you were like, we always think of we up north, we're like learning from down south.
Oh, yeah.
So it was kind of neat to like switch the roles a little bit there.
One of the head people on research and treatment of Lyme disease was out of St. Mary's in Duluth. One of the infectious disease doctors. He was national. He was the guy back in the day. So yeah, we were pretty cutting edge. Now we keep track. There's a wonderful internet website that most professionals use, and it's called Up to Date. And that's where we can find all the current research and treatment recommendations for everything, but of course Lyme too. And if there's any questions, then that's where we usually head to. And that's all the experts keep everything current on this website.
And I imagine, you work with a bunch of other professionals here. It must be fun to be able to, when you hear something, to share it with someone you work with.
Oh, absolutely. You bet. Especially if they didn't do something that you think they should have done. Okay. Then you share it right away.
Right, exactly. Oh, by the way.
Yeah. Right. No, I'm kidding.
Yes.
Right. And we're bouncing off each other all the time. I mean, and that's what makes a group practice so cool, because you're not isolated. You maybe hear about people, they're working alone, but no, in medicine, everybody's always talking to everybody.
And also here at NorthLakes, where we do have this kind of an integrated array of services, must be nice to have a lot of different providers in the building that you can collaborate with.
Yeah, if you have a dental question, we can get it answered. That's pretty awesome.
Yeah. Well, I guess I got one last question for you, Tom. What's in your car right now?
I drove my motorcycle.
Oh, what's in your motorcycle right now?
My helmet.
All right.
That was a bad answer. Yeah, that is just my helmet.
Well, that's all you need.
Okay.
Well, anything else that you want to talk about, or anything that we should cover?
I guess just to reiterate, make sure you're doing tick checks every day. If you're out in the woods, use insect spray. If you're not into the DEET, they make DEET freeze anything. If you're out in the woods, tuck your pants into your socks. When you get home, do the tick checks. That's really important. If you find the tick, try and identify it. If not, let us know. We can help out. Pull the tick out, use the tweezers from the head and just pull it backwards. If the head is in, that's not a big deal. And if it is, we take them out all the time too. Watch for Lyme symptoms, 3 to 10 days after: fevers, chills, joint pains, feel like you've been hit by a truck, bad flu stuff, then you definitely need to go in and get seen.
I did think of something else. So a lot of friends of mine, I'm not a dog owner, but a lot of my friends are. What about like when your pet has a lot of ticks? Any precautions you should take while you're I know you're not a veterinarian. I'm not asking a dog, but like...
Don't hug your dog all summer.
Right.
We're always pulling ticks off our dogs.
Right.
But I don't know. I'm sorry.
So I guess the question is just that if you are you more at risk if you are a dog owner that animal is going to bring a tick in your home?
Absolutely.
So So just keep an eye out if you're a dog owner.
Yeah, you definitely. I mean, that's a tick vector, and you're going to be bringing them in.
This is my dog, tick vector.
Whole new name.
Yes. Well, thanks a lot.
Yeah, thanks for having me.
All right, good to see you.
All right.
Thank you so much for sharing so much information, Tom. I feel like I'm much better prepared to go out into the woods and fields safely. The NorthLakes podcast is produced by NorthLakes Community Clinic, a community health center with locations throughout northern Wisconsin. Our mission is to respond to the healthcare needs of our communities with an integrated array of quality services and actively remove barriers to wellness. And after this conversation with Tom, I think I can safely say that we actively remove ticks as well. Learn more about all we do here at NorthLakes Community Clinic by visiting our website, nlccwi.org, or give us a call at 888-834-4551. If you have people coming to visit you and they want to learn more about Lyme disease, please share this episode with them and then give us a review wherever you found the episode. It helps other people find the podcast, and then you can ask them what they have in their car. I'm Jeremy Oswald, Marketing and Communications Specialist here at NorthLakes. Thanks for listening.